Hello everyone, my name is Murzafat Adria. My teammates are Osman Najibek and Bigit Safenur, and today we are going to talk about sex-transmitted infection as a consequences of adolescent pregnancy.
Nowadays, an increasingly prevalent concern in today's world revolves around the emergence of health challenges linked to intimate relationships. As societal norms evolve and sexual behavior continues to diversify, the risks associated with sexual encounters are garnering greater attention. In this landscape, addressing the complexities of sexual health becomes paramount to safeguarding the well-being of individuals and communities alike. Today, we're going to talk about sexually transmitted infections. Sexually transmitted infections represent a significant public health challenge globally, affecting individuals of all ages, genders, and sexual orientations. These infections are primarily transmitted through sexual contact, including vaginal, anal, and oral intercourse. STIs encompass a diverse range of pathogens, including bacteria, viruses, parasites, and fungi, each presenting unique symptoms and health consequences. Despite advancements in prevention and treatment, STIs remain pervasive, with millions of new cases reported each year. Addressing the complexities of STIs requires comprehensive strategies that encompass education, prevention, and accessible healthcare services to mitigate their impact on individuals and communities alike.
Most sexually active people will be infected with human papillomavirus, or HPV. There are over 500 types of HPV, and most of the time the body eliminates infections without symptoms, but some strains can pose serious health risks down the line. HPV causes contact infections, which means the virus stays in the cells near the point of infection, rather than spreading throughout the whole body of people. Since HPV is often transmitted through sexual activity, this usually means the cells of the vagina, vulva, penis, and anus, mouth, and throat. According to the statistics of World Health Organization, 1 in 4 sexually active teens will contract an STI, and in this year, 40,000 teens will contract an STI. The main causes of this problem is peer pressure and risky behaviors. Adolescents are particularly susceptible to peer pressure, which can lead them to engage in sexual activities before they are ready or without proper precautions. Second one is about lack of education and awareness. Many teenagers may not have sufficient knowledge about STIs, their transmission and prevention methods. And last one is limited access to healthcare and prevention resources. Teenagers often face barriers in accessing healthcare services, including STI testing and treatment.
An HPV infection that doesn't go away on its own can cause changes in the cells of the cervix, leading to precancerous lesions that, if left untreated, can develop into cervical cancer. Typically, it takes 15 to 20 years for cervical cancer to develop after HPV infection. How dangerous HPV for men? Most often, men are carriers of the virus. Despite this, highly oncogenic HPV types can still cause cancer of the penis and anal area. In practice, this disease is much less common compared to the incidence of cervical cancer in women.
Studies have shown that the HPV vaccine is highly effective in preventing infection with the HPV strains it targets. For instance, a study published in The Lancet found that HPV vaccination reduces the prevalence of high-risk HPV types by 83% among teenage girls in England within a decade of implementation. The HPV vaccine significantly lowers the risk of developing cervical, anal, oropharyngeal, and spinal cancers, as well as genital warts. The HPV vaccine contains virus-like particles made from the protein of HPV, mimicking the virus outer coat without its DNA, making them non-infectious. Administered intramuscularly, usually in the deltoid, virus-like particles are taken up by antigen-presenting cells, like dendritic cells and macrophages. Antigen-presenting cells process virus-like particles to migrate to lymph nodes, presenting fragments on major histocompatibility complex class II molecules. This activates helper T cells recognizing the antigen. These cells blind virus-like particles through surface immunoglobulin receptors, internalize process and present them on major histocompatibility complex class II molecules, leading to their activation by helper T cells. Activated B cells proliferate and enhance antibody specialty and affinity in lymph node germinal centers, producing high-affinity antibodies against HPV proteins. Moreover, some activated B cells become plasma cells, producing large quantities of HPV-specific antibodies in the bloodstream and mucosal surfaces, and other activated B cells become memory B cells, which persist long-term and rapidly respond to future HPV exposures. These processes occur similarly in men and women. In women, the vaccine primarily prevents cervical, vaginal, and vulval cancers, while in men, it helps prevent spinal, anal, and oropharyngeal cancers, as well as genital warts in both genders.
So now let's talk about the economic impact of scientific interventions on physical health consequences of early sexual relationships. So early sexual relationships can have significant physical health consequences that necessitate scientific interventions. The economic impact of these interventions can be analyzed by looking at the advantages and disadvantages through scientific reasoning, statistics, facts, and examples. Now let's talk about the advantages of scientific interventions. Firstly, reduction in teen pregnancy rates. Scientific interventions such as comprehensive sex education and access to contraceptives can significantly reduce teen pregnancy rates. According to the Centers for Disease Control and Prevention (CDC) 2020, comprehensive sex education programs are associated with 50% reduction in teen pregnancies. This reduction decreased the economic burden on healthcare systems and social services. For example, the National Campaign to Prevent Teen and Unplanned Pregnancy 2016 estimated that the teen childbearing costs U.S. taxpayers approximately $9.4 billion annually. By reducing teen pregnancies, this intervention can save billions in public expenditures. Second is prevention of sexually transmitted infection, STI. Interventions such as regular STI screenings and the promotion of safe sex practices can prevent the spread of STIs. The CDC 2019 reported that there are nearly 20 million new STI cases each year in the United States, costing the healthcare system about $16 billion annually. Effective scientific interventions can reduce these costs by preventing infections. For example, a study by Owusu Edusei 2013 found that every dollar spent on STI prevention saves $2.65 in medical and social costs.
Scientific interventions can improve overall health outcomes for individuals who engage in early sexual relationships. Access to reproductive health services, including counseling and medical care, helps address the physical health consequences of early sexual activity. According to research by Lindsberg et al., 2020, comprehensive sexual and reproductive health services lead to better health outcomes and reduced rates of adverse conditions such as pelvic inflammatory disease and cervical cancer.
Now let's talk about the disadvantages of scientific interventions. Firstly, cost of implementation. Comprehensive sex education programs, widespread availability of contraceptives, and regular STI screenings require substantial funding. For example, the Guttmacher Institute 2017 estimated that providing publicly funded family planning services costs approximately $2.4 billion annually. While these interventions save money in the long term, the initial investment can be barrier for some communities and governments. Second one is cultural and social resistance. Scientific interventions often face cultural and social resistance, particularly in regions with conservative views on sexual education and reproductive health. According to a study by Hall, 2016, nearly 40% of U.S. parents preferred abstinence-only education over comprehensive sex education. This resistance can limit their effectiveness of scientific interventions and hinder their implementation, leading to a continued high rate of teen pregnancies and STIs.
Despite the availability of scientific interventions, there is a risk of misinformation spreading about sexual health. Inaccurate information about contraceptive methods, STI prevention, and sexual health can undermine the effectiveness of interventions. For instance, a study by Eisenberg et al. 2013 found that 23% of teenagers received incorrect information about birth control from their peers or online sources, which can lead to higher rates of unintended pregnancies and STIs.